My name is Maddie Kinscher, and I am an AHEC intern who worked for Sheboygan County's Health and Human Services. I will be entering my junior year at the University of Wisconsin-Stevens Point, where I'm majoring in health promotion and wellness and minoring in biology. This summer, I've interned in the Public Health Division for Sheboygan County. As you can see, I was able to accomplish a lot throughout my time in public health. However, my main responsibility was to construct a community-wide survey about the gaps in mental health care access. The purpose of the survey is to identify the reasons Sheboygan County citizens aren't accessing the mental health care that they need. This is a part of the 2020 Positive Mental Health Initiative. The research involved for forming questions for the survey had me visiting the Mental Health America office in Sheboygan to gather insight on what they see in local gaps to mental health care, and using NAMI and NCBI to see what national studies have found. I also interviewed those who attended an AODA safe zone called Open Door. There, I was able to directly hear from those being affected by gaps in mental health care access. To construct the survey, I decided to list the demographic questions first, as they are the quickest to answer and would encourage completion of the survey. Other required questions include history of AODA and mental health, history of mental health treatment, and two of the most prevalent barriers seen in research, finances and providers. When we ask them about the barriers, we allow them to further explain why these are barriers for them. This way we can better identify what exactly needs to change to get people the care that they need. The last part of the survey asked optional questions about other barriers such as resource knowledge, social stigma, transportation, and time commitment. I connected these questions to a logic setting that direct users to a specific question depending on the previous answer. For example, those who said they did feel social stigma will be taken to question 21, asking them to further specify. If they said no to that question, they will be directed to the next barrier question, number 22, without seeing question 21. Thus encourages completion of the survey. The survey will be sent out electronically through a URL and in paper copy forms to be translated into Spanish. Data will be collected from July through the fall. One lesson I have learned from this process was the importance of using your resources. Mental Health America and Open Door were both local and proved to be the most educating during my planning process. Another is differentiating between nice to know versus need to know information. For example, I did not ask them to rate their level of health because that information is not needed to improve access to mental health care. When constructing a project, you must keep the main idea in mind. Lastly, I learned about all the different perspectives when it comes to barriers of care. Simply identifying a barrier, but not knowing why it's a barrier, will not allow us to maximize health services. This experience with Sheboygan County has given me a new outlook on public health. It has made me a more well-rounded and prepared healthcare professional. Thank you again for AHEC and Sheboygan County for this opportunity.